If you suffer with dizziness and vertigo, then we've got some tips for you. Hi, my name's Katie from goPhysio and welcome to our next goPhysio talk session. I'm here with Lottie, one of our advanced sports therapists, to offer some helpful information and bust some common myths around benign proximal positional vertigo, also known as BPPV. So Lottie, thank you for joining me first of all, but what exactly is vertigo?
So vertigo is a descriptive term and it describes a sensation where there's movement between you and your environment. It can feel like you're moving or the environment around you is moving, and it's often a horizontal spinning sensation.
And what would you say could cause that in a patient?
So generally by a sensory mismatch between your vision, your proprioception and your vestibular system.
And by vestibular system, you mean?
So it's located in your inner ear.
As demonstrated.
And it's made up of fluid-filled canals, which are orientated in different directions to detect different movement in your head. As your head turns, the fluid in the canal will shift, and this stimulates little hairs, and it sends information to your brain.
So how would that mismatch first happen?
So at the end of your canals, there are tiny crystals which can become loose and move into the main body of the canal, which will change its function and send the wrong signals to your brain.
Essentially making the brain confused.
Yeah, and making you feel like you're moving when you're not. These crystals can become loose because of head trauma, viral infection, aging, and this is common with BPPV.
Okay, so you're going to have to explain BPPV then. So benign proximal positional vertigo, right?
Yes, so benign means it's not dangerous. Proximal means it comes and goes. Positional means it's triggered by movement. And vertigo is that spinning sensation. People often say they feel it when they roll over in bed, they feel the room spinning, or when they look up and down, they get really dizzy for a few seconds. That's classic BPPV.
And how would they know that they've got PPPV, or what might it feel like?
So your symptoms come and go with your position you're in. So you might have periods of time where you're symptom free, when you're still. The dizzy spells will last approximately a minute, and these episodes can come and go.
So not all dizziness is BPPV then?
No, dizziness that lasts hours or days, ringing in your ear, hearing changes, and it feels like you've got lightheadedness or passing out, not BPPV. We'd want to have a look and probably refer you to your GP.
But if it's short, spinny dizziness, then it might be PPPV.
Yeah, and we can definitely help. In the clinic, we assess it all the time. We go for a full assessment and treat you the same day.
So then, regards to treatment then, what would you advise?
So it's easily treatable. One of the most effective treatments is called the Epley manoeuvre. It's a series of really slow guided head movements that help loosen the crystals and move them back to where they belong in your inner ear. The total manoeuvre usually takes a few minutes. Some people feel better after one, and others it might take up to 5.
And how would someone feel after they've had the Epley manoeuvre?
A little bit wobbly for a day,
Okay.
but that's normal as the crystals settle back down like sediment in sand. We do it all the time in clinic, and there is some aftercare advice to follow. So we advise you avoid driving for the first 24 hours until you feel comfortable. Sleep propped up for at least 2 nights after, and avoid lying on the treated side for 4 nights. Avoid vigorous head movements, fast rotations and looking up and down like going to the hairdresser or tying up your shoes.
Okay, that's great. But what would your key takeaways be from this?
So to sum up, BPPV is common for dizziness, and it's caused by head movement. It's due to the crystals floating into the wrong bit of your ear and confusing your brain. The Epley manoeuvre is simple and effective. We do all the time, but if you're unsure, get it assessed and we can help figure it out. You don't have to live with it.
Let's get you sorted. If you think you've got BPPV or any sort of vertigo, do give us a call. Thank you so much for explaining that, Lottie. That's really complicated in my eyes, but I'm really thankful that you're here. If you want to find out a little bit more, or perhaps you've been suffering with BPPV or not had any idea what can help, leave us a comment below or message us on our social media channels. Our clinical team are here to give you more practical advice and real life solutions, helping you live a healthier, happier life and adding life to your years. We'll see you soon. Thank you.